Hey, Dr. Gullberg here. Thank you for joining me on our mnemonic series in medicine. Today we're talking about cardiology. We're talking about pericarditis. Pericarditis, something that you need to be familiar with. Excellent word for the mnemonic today. A divan, D-I-V-A-N, which is a type of a couch. Excellent word for pericarditis. So our case is a patient who comes in with a history of lupus, comes to the emergency room with acute onset of sharp chest pain, worse with bending forward and taking a deep breath. And of course, you suspect pericarditis or inflammation of the pericardium. The mnemonic is divan. D is for Dressler Syndrome. So Dressler Syndrome is a syndrome of inflammation of the pericardium because of a transmural myocardial infarction. Dressler Syndrome. I is infection or idiopathic. Infections that are associated with pericarditis include bacterial infections from contiguous sources from pneumonia, or idiopathic means we really never do find out what causes the pericarditis. Believe it or not, that's a fair amount of time. V is for viral. Most common viruses associated with pericarditis include influenza, include the enteroviruses such as echovirus or Coxsackie virus, and then of course varicella and HIV. A is for autoimmune disease such as from lupus or rheumatoid arthritis, and N is for neoplastic disease such as from lung cancer, breast cancer, or lymphoma most commonly. N also is for nephrogenic, which stands for the uremia that can cause uremic pericarditis. The key for the chest pain is to look for people who have chest pain bending forward or on taking a deep breath. Listen to a pericardial friction rub, bending forward. Check for ST segment elevation globally in the EKG, and this is often in all the leads. And then, of course, for treatment, we use NSAIDs, colchicine, or prednisone. If this doesn't work, sometimes a pericardiotomy is required or an ectomy, especially if there's a pericardial effusion secondary to the pericarditis. So, good word today, divan, D-I-V-A-N. Thanks for joining me. Have a good day. Bye-bye.